Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? Working in the ER we had some interesting ones, but the simplest and most intriguing one I've had was a man came in complaining about chest and side pains. After a few tests to rule out heart issues, we discovered through an x-ray that the man had 19 fractures throughout his rib cage. When I asked him if he had been doing anything dangerous, he replied with nope, just dancing. Needless to say, I'd recommend not trying to do leaping flops into the worm on repeat on concrete, which is the only way I can fathom this occurring. And no, he didn't explain what kind of dancing. Well, he sure wasn't doing the safety dance. The human capacity to deny the undeniable is amazing. As a radiologist, I've seen an 80-pound ovarian tumor, a hand-sized facial malignancy neglected until it eroded an underlying artery, numerous neglected breast cancers, eroding through the skin. People will refuse to see what they really don't want to see. My mother is an emergency nurse, and a while back a 90-year-old woman came into the department complaining of pain in her leg below the knee. After an examination, my mother suggested an x-ray. X-ray comes back and it turns out the leg had been broken several months prior, snapped clean across both the tibia and fibula, and she had somehow ignored what must have been excruciating pain and continued about her life. And then the bones had healed but not straight. The top of the bones were to the left and about 2 inches below where they were supposed to be, and they had fused to the lower parts at the side like that. In the end, there is nothing that could realistically be done, as to sort the leg out would require a breaking it. Dang, I didn't know human bodies could do that. Training as an EMT, so not a doctor, but in the air. Old guy shuffles in with his girlfriend, both mid-50s. He is holding a members only jacket in front of his crotch and waddling in. We take him through tridge to the back and get him on the exam table. His scrotum was the size of a large watermelon. It hung below his knees and was easily 18 inches in diameter. Serious hernia issue. Just a big oblong mass of flesh that had overwhelmed the rest of his nethers. I think every physician in the hospital came down to consult on it. I mean everyone. Cardiologists, ENTs, etc. Everyone made an excuse to come take a look. This was clearly an issue he had been avoiding for years. The prescribed treatment, if I remember properly, was to Kevlar reinforce his belly and shove all his intestines back up and in. They were going to transport him to a nearby hospital for the treatment, but because it was across state lines he refused to go. So he slid off the table, pulled his jeans up around his crotch, grabbed his jacket and his girlfriend and shuffled off to the bus stop. It's an image you never forgot. Closest thing I can relate it to is when Hugh Jackman is trying to carry the fishbowl between his legs in The Prestige. Doctor friend told me of a man with a flower stalk stuck up his penis. He was trying to give his GF a birthday surprise. Unfortunately, flower stalks have little angled hairs on them which make them easy to push in but impossible to take out. Saw a guy who had a pretty blunt machete lodged perfectly across the middle of his skull, but the angle was unusual and it was like perfectly along, so that caught my attention. Turned out the guy had, unsuccessfully, tried to murder his wife with the machete and later regretted it, so he hit himself in the head with it. He held it with his hand, sharp side front, and gave himself a whack perfectly in the middle of his skull. Thankfully the machete barely made it into the skull, and since it was along the middle it didn't touch any brain tissue. Work in a burn center. For 3 months in a row we had 3 different people come in because they tried to commit suicide by setting themselves on fire with gasoline. I cannot imagine what brings someone to that point to think that's a good way to go out. Those burning monks protesting the war in Vietnam come to mind. Not a freaking peep. While they sat there cross-legged. I don't know that I understand human. Just last week I had a guy over 400 pounds, BMI 60. He was a hoarder and kept getting cellulitis in his legs because his house was so cluttered he kept hitting his legs into things and getting cuts and infections. When he came in we had to remove his socks with scissors because he hadn't taken them off in over 3 months. His socks had embedded into his skin and somehow become one. I didn't learn in medical school how that happens. Had a lady come to the morgue in pieces for several days. She had fallen off a catwalk thing into an industrial fan that had no guards due to a cleaning being performed on that area in a factory. They were having trouble finding all of her. It wasn't explained to me until 3 days after the first piece showed up, so I thought there was a serial killer out there for a bit. I didn't see morgue the first time I read that and was very confused. My friend is a doctor and worked in Africa for some time. You can imagine, the hospital itself was a house you could also have a school in. If no doctor had time, even the janitor would stitch you up. One day, 2 people came in, one with an axe in the head. Surprisingly, he was still alive. When trying to get the operation prepared, my friend asked the other guy without an axe in the head who he was. Brother? Cousin? Dad? Friend? No, neither of them. He was the owner of the axe and just wanted his freaking axe back. Nurse here had a patient come in due to pain in her chest 4 months after having a mastectomy. When we changed her dressings, the site was so infected that I could see her lung inflating when she took a breath. She died a week later. Still don't know why she didn't come in earlier. I can't even begin to imagine how painful that had to be. Heartbreaking that she died. A PA I work with saw this patient with an external fixator. Normally these are rods and screws outside the body holding a fracture stable until swelling or what have you goes down so they can operate and internally fix the fracture. They're normally on for a few days. Cut to this guy's office where a patient walks in one day with an X-fix on his leg that has been there for 3 freaking years. The guy lived a normal life and just thought it was the way they fixed legs. How he never got an infection I'll never understand. I've heard surgeons refer to the trauma unit as relentlessly working directly against natural selection. Use your imagination. They've seen a lot of Darwin Award candidates. Post-surgical nurse here had a guy with necrotizing fasciitis, flesh-eating bacteria, on his scrotum. Had a wound vac that kept leaking. I had to change it. Was not pretty. By the end of it we were both traumatized. I'll never forget the agony that poor guy had to go through. But, on a good note, he healed up eventually. This is often called Fernie's gangrene, and as you may imagine, it's pretty bad. A farmer from a rural area was using a table saw on a hillside. In the midst of cutting wood to build a shed, he slipped on the hillside and lopped off his penis. How plausible this is, whether he was lying we will never know. Rather than seek medical attention, he takes a castration ring used to stop bleeding from castrated goats he kept on the property and shoved it down around the stump. If that isn't bad enough, he also began to have horrific swelling and decided to use a rabbit water bottle feeder, the kind you see in pet stores, to prop open his urethra so he could pee. He stayed like that for 3 days until he started to have fevers, redness, swelling, etc. due to infection. When he got to the triage nurse called the urology team. We have pictures. Basically what ended up happening was his urethra was translocated to his perineum so he could still urinate, and his infected, necrotic penis was excised alone with a portion of his scrotum due to the severe cellulitis in the area. He ended up making a full recovery after skin grafting to the area. A farmer from a rural area was using a table saw on a hillside. You just know it's going downhill from here. Work in the ED as a medical student. Had a guy the other day who let a leg infection get worse for years, and when he finally came in his infected leg was at least 4 times the size of the other one and was draining copious amounts of foul smelling pus. If the infection had been seen earlier, he would have just needed antibiotics. Because he waited so long, he's going to lose the leg, if not his life. Not me, but a nurse friend. Guy comes in complaining of pain sitting down. Pain in his rectal area. She goes to take a look and this man's anus is so infected it was almost gangrenous. The infection wasn't just around the anus. It had traveled inches deep into his body, literally using pus. One nurse had to excuse herself and almost passed out due to the smell. I was told. No idea what caused it or whatever happened to the poor guy. Probably injecting drugs Swamp of Dagobah style. 70-year-old guy came into the VA clinic for a bad cough and admitted due to temp of 104F. He was mine and I found lumps on his neck on exam. He had tuberculosis, scrofula. So, why does he have TB in the US? We do HIV test and he's been with some prostitutes. He also developed some other complications and was finally discharged after 4 weeks. Poor guy got a cough from sex. My cousin is a paramedic in a large city and had these stories. 1. Victim is a powerlifter with a home gym. Tries to squat too much weight, and on the upward push herniates his sphincter. When he got there the man had 6-8 inches of his small intestine coming out of his ass. Apparently the medical street slang for this is red socking yourself. 2. Victim is a man with a flashing fetish. Late in the night, He walks to a 7-Eleven, waits until the female cashier turns her back, and then opens his jacket so his erect member is lying on the glass countertop by the register. In a panic, the cashier grabs the first thing she could find, a can of tomato soup, and in an adrenaline rage brings the can down on his erect penis. He said this apparently almost entirely severs the man's penis, which fully erect is moving a lot of blood through it. He said the man nearly bled to death and the 7-Eleven looked like a murder scene when they arrived. Please don't think about doing M's unless you're willing to see some truly horrifying crap. I have seen all manner of weird and wonderful things, yet the most perplexing was a young girl we nursed in PICU with history of pica. When we took her for x-rays, due to her complaining her stomach was hurting, we found a belt buckle, a full-size spoon and butter knife, as well as an assortment of batteries. As far as I recall, as it was some time ago now, they had to operate immediately to remove, and again if I recall correctly it was the batteries they were most concerned about, as if one exploded started leaking it would have caused irreparable damage. I have never seen a set of x-rays like it, and seeing was believing. Incredible how the heck she managed to get them in there, but never underestimate the willpower of psychosis. This thread taught me what a million anti-drug commercials in high school couldn't. I'm not a doc but a medical technician, still in college, but you see some crap nevertheless. There was a guy who had a car accident damaging his cervical spine. Our occipital surgeon did an amazing job, so after a long process of recovery the man was able to walk using only a cane. Another problem he had was some neurologic muscle illness, not sure if myasthenia gravis or something else, which made it hard for him to do any fine motor movements. Although he had all these health issues, the guy insisted that he is independent, so he did all of his daily activities on his own. The problem occurred when he went to his beach house on a vacation and went to take a bath. He lied into the tub and turned the water on. Then he turned on the hot water and realized that the faucet isn't the same as he had back at home, and because of his motor skills being bad he didn't manage to turn the hot water off. Result: 2-3-degree burns on the left side of his body, from head to toe as he was laying on his side. He almost cooked himself to death. I don't even get in the tub in my own house without testing the water first. It's just not comfortable, even because you're sort of wet and cold. My doctor was very confused how 9-year-old me managed to completely rip my big toe's nail out at 3 AM. I tripped running down the hallway on the way back from the toilet, cause you know monsters, and slid along my carpeted hallway. The friction between my toe and the carpet ripped it out. OMG, I think I just shaved 3 years off my life by reading this. A very tame example, but here's one. An ex-nurse told me, one day a patient came in who had basically no social interaction whatsoever, so he looked like a complete mess, with hair nearly down to his hips. As the nurses cleaned him up they noticed his hair was quite thick around his head, and they couldn't cut through it. Turned out the guy had been wearing a beanie for the last 10 years and his hair had just grown through it and over it. Wow, I wish there were pictures on this one. I've had a patient with myiasis on the nose, who had flies coming out of his nose. Number. Everyone asks, what does the fox say? No one asks, how does the fox feel? If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.